Steve here, Concierge Health Advisor. Whoa, continuing on. The Medical Myths series. Oh dear, medical myths. Medical myths? You're just a quack. No, don't think I am. To consider who a quack is, you need to see the life expectancy of the non-quack, supposed non-quack, how they look in their health, how they measure up in their health. And then let's compare notes. Not just a few people, a few big swaths of population. That's what I advise. I was looking at dying in my 60s, early 60s, statistically speaking, and I've probably bumped it up by another, I don't know, quarter century. So let's see how I go. Let's compare notes in hopefully 50 years, but 30 years is fine. So you clicked on it. I don't even know what I've called this. You know it before I do, because I'm going to name it after I record this. Anyway. So when the pharmaceutical industry acts on diagnoses. Let's do some research. Let's do some research on this protein, for example. Let's do some research on this cancer drug. Yeah, one of those mornings. 13 years of research, 20-year patent. Since the 80s, since perhaps the newer age psych drugs, since perhaps some of the indigestion drugs, perhaps blood pressure meds, yeah, maybe, but since the 80s, the pharmaceutical industry, their whole discovery, research and development, and mark-to-market type process, the whole process from R&D to selling and the whole patent complex, 20 years. It's been tanking, and maybe the whole idea of the more vaccines being in the pipeline is part of rescuing the whole pharmaceutical industry. Maybe they're not making that much money, because even what they do discover, which has very limited statistical benefit for our symptoms, because they're only addressing our symptoms, they're not curing us, particularly when it comes to chronic disease, autoimmune disease, the whole metabolic syndrome complex. They're not making money, even though there's drugs that cost $1,000, $100,000, $1 million. Well, maybe per year for the $1 million ones, right? So with the oncology drugs, some of them. And all this, all these medications, they're not drugs, they're medications. They're designed to help us make us live longer, this and that. Don't get me wrong, the whole mainstream healthcare complex, if I'm stabbed, shot, hit by a bus, get me in that emergency room, because that's all that the allopathic medical model is designed for. Soldier, get back on that battlefield. Hey worker, there's your workers' compensation now. Get back to work, right? So, yes, allopathic medicine, the mainstream healthcare model as we know it, has its place, preserving life in an emergency sort of situation. Fine, okay. Great. But with the indigestion stuff, the mental health stuff, the cancer, the obesity, all those things I just mentioned, even dental, is getting worse because they're not understanding. They, as in the mainstream healthcare model, the allopathic medical model, doesn't understand the chronic healthcare complex. So, maybe the major, I think there's 6 major pharmaceuticals out there. Maybe having 200 or 300 vaccines down the pike in the adult schedule, that'll save them, because I don't think vaccines are designed as medicines or pharmaceuticals. They're called biologics. So the whole 3-stage research process, stage 1, 2, 3 in animals, stage 1, 2, 3 in humans, right? It's not that stringent with vaccines. So maybe the pharmaceutical industry will be saved with that. So also, if the mainstream healthcare complex is designed to make us live longer and also live longer in health, how come the place, the country that spends more money on healthcare than the rest of the world combined, 200 plus nations, the US spends more on healthcare than all the other countries combined? Guess what their expected life expectancy is? Well, I think it's about 77, whatever the number is, but it ranks number 40 in the world. Between 40 and 60th, actually, on some metrics. Let's just say 40. Surely you should be in the top 10, spending more on healthcare than the rest of the world combined. More than 50% of the world healthcare is being spent by the US, and they're ranking 40th. No, you see. Come on. It's their lifestyles. It's their life choices. It's their genetically modified this and that. Like, come on. You can do better than that. There's more gyms per capita in the US as well. Right. Which also probably points at how ineffective the calories in, calories out metric is. A century-long failed theory. But you see, I've lost weight. I've lost 3 dress sizes. I've lost 50 pound. I've lost 100 pound, whatever. I lost about 130 or 40 pound, 200 pound off the top, but yeah. Since I started what I advocate here with micronutrients and the like, that's how I'm preparing to save the world, or saving at least a few people that this all resonates with, right? So, if some of the countries in the world barely have roads and running water, and they have 1 in 400 people living to 100 plus, where in the US it's 1 in 10,000 living to become a centenarian. What's going on there? You see, it's complicated. They pray a lot, and they have family around, and they exercise. They tried that with the Okinawans. What happened with the Okinawans? Come on, let me tell you. You can do better than that. Like, we exercise, we're spiritual people, and we get out in the sun. Oh boy, come on, you can do better than that. After a quarter of a century, seeing how they go to the toilet and all that sort of thing, and they're doing exercise over there. Oh yeah. How about the women? They don't do exercise. How are they gonna? They're still living longer than the fellas. So what's happened in the Okinawa is that the ladies. Just, the research that was looking into this didn't glaze over this particular detail. We just put some ash into our noodles to give it more colour, more texture, better taste, right? And unknowingly, the ashes have a lot of the minerals that we require to live healthier and longer, and that's why the Okinawans have been living longer, together with their seaweed consumption, which adds to the whole mineral intake complex. And also, by not having these days, it's a little bit different. Even the Okinawans are going downhill in their life expectancy. They got more gluten creeping into their diet. But before, because they didn't have gluten in their diet, they were able to absorb much more of the minerals that we require. What kept the Okinawans back to not live 130, 150 years was that they were starting to load up on a lot of oils in their diet. So, gluten, oils, sugars, and nitrates. In case I doubled up on the nitrates. Those 4 food categories we need to cease. Otherwise, we won't be readily living past into centenarian years. So, for any people that this resonates with, the website is on the episode, the video notes. Have a look. I've got gold, silver, bronze service offering. I know. The prices will give someone hyperventilation. I might even kill them. But you can do it all on the cheap, on free. You just have to wade through the content. I'm not going to hold your hand. But if you really want efficacy, the efficacy of the outcomes, the health outcomes of even the symptoms and the diseases that you have now, look into it. I got rid of half a dozen different chronic diseases, including obesity. Looking fairly fit for the last 1.5 decades of being obese. I'm doing okay. So there you go. Look into it. So a few things don't make sense with the US. How come poor countries are living better than the US without any healthcare, barely any roads? And there you have it, right? Just some of the things in the Medical Myth series. And that's all for now. Just another video to add some more insights into what the heck is going on here, right? So there you go. Bye-bye for now.